Hi, I'm Christine Morgan, and I'm here today to tell you a little bit about what it means to be in a body that has lymph node removal. But first, let me just explain to you briefly about myself. I am a specialist in lymphatic drainage, and I work with women primarily with breast cancer who have had lymph node removal. I have been trained in complex decongestive physiotherapy in the Vater technique of manual lymph drainage in Austria. So that's a lot of words to say that it's very credible what I'm about to share with you today. There is a history of experience and background. And the reason why I want to share this today with you is because there's so much fear around the word lymphedema that I'm really hoping to get the message out to you that there's nothing to be afraid of. This isn't something that blows up overnight by surprise and takes you by storm. This is something that the more education and information that you have, the easier and more equipped you will be to make decisions about your life. So, let's begin. I'm going to do this without my charts so that you can feel it more in your body. So, typically, especially for women who have had breast cancer or any kind of mastectomy, there is either sentinel node taken or full lymph nodes taken from the axilla area of the arms. And what that means is that you are then missing a critical piece to the filter that your body has usually in place. And so what we do as lymph drainage therapists is find ways of alternate pathways to take whatever fluid that flows through that filter to another section of the body. And we're trained in that, we understand the mapping, and you are in great hands when you go and get a lymphatic drainage treatment. So just a little bit more specifically, the reason why you would want to see a lymphatic drainage therapist is because oftentimes when you're missing a filter, you don't necessarily know whether or not there will be an accumulation of fluid, whether it be over time or whether it be in the form of different symptoms. Some of those symptoms that occur, oftentimes ladies attribute them to the surgery, which could very well be if you are within 3 months of your surgery process. But if you are 3 years out and you're still having the same aches and pains around your scar area, then it's very likely that you may have the initial symptoms of fluid accumulation. I don't even like to use the word lymphedema because it's like Greek. And we don't want to speak Greek, we want to speak English. Anyhow, so let me just give you a little background in the lymphatic system. All the initial lymph vessels lay right in the epidermis of the skin. And when you stimulate your skin, it actually creates this stretch whereby those initial vessels fill with fluid, and like a little chain reaction, like a inchworm, it moves this lymph along in its channels deeper and deeper through the body, following this one-way system all the way up to the neck area, and takes that wonderful, clear, cleansed, and purified fluid back to the heart. And it only does this with 10% of your bodily fluid. So when you have your lymph nodes removed and this filter is then compromised, you have a tendency possibly for that fluid to accumulate and create some discomfort that sometimes a lot of women have said to me are in the form of these adjectives: tingling, tightness, burning, a numbing sensation. It could occur in the back of the arm. It could occur around your drain site or your scar. You could actually have what appears to be a swollen breast. You could definitely have, your jewelry feeling tight or the limb itself swelling. A lot of ladies also get a swelling pocket right inside their bra line here, and they are unsure why. So those are all signs that there might be just some backup around what used to be a very efficient filter. So I just want to show you a little bit of this chart to give you an idea of what can happen to help you with that. So if you go to a certified therapist, they will understand this map a little bit. And it's going to look like gobbledygook to you right now, but what I want to point out to you is if you had lymph node removal here, and you suddenly started feeling symptoms anywhere in this area, a lymph drainage therapist knows to stimulate the opposite side to create this flow in the opposite direction. And if you look at the screen, that fluid then can cross its watershed line and go to a filter that's already working, both here in the front of the body, here down alongside the body, crossing the waist and bringing it down to all these lymph nodes here, and also across the back of the body, and thereby giving 1, 2, 3 alternate routes whereby this trapped fluid could flow. It's just remarkable. The body's quite remarkable. And also we can even take it up to the neck, which is the main drain of the body, thereby giving your body all these other alternate pathways to help flush out any trapped fluid because of your surgery. There's definitely a special technique used in lymph drainage to directly affect the lymph vessel wall and create that automotoricity that will really get that lymph pumping by 10 times your regular body flow. So it's just really awesome. I totally support lymph drainage, and I'd love for any ladies who have had any lymph node removal to see a certified therapist, learn a little bit more about your body, get a lymph drainage session, and just get to know your body differently. It's had a little bit of an adjustment, and it's not anything that can't be compensated for that you wouldn't learn about. So I hope this little session was helpful. There are other videos on the web that talk about skin brushing, which is a self-help technique that can really help you boost your lymphatics too. And this whole process ultimately boosts your immunity, which most people know is really quite the ticket to wellness. And speaking of wellness, I do facilitate wellness retreats during the month of July and August at Grass Lake Sanctuary, so please visit that website to learn more about those retreats for cancer survivors. Thanks! Enjoy your new lessons with lymph drainage.